Masturbation is a natural, common, and deeply personal activity that people of all ages engage in. And while it's often talked about during adolescence or in the context of younger adults, the truth is that men and women over 60 continue to explore and maintain their sexuality, including solo pleasure. And yet many older adults are left wondering whether their frequency is healthy, harmful, excessive, or even inadequate, particularly when so many social messages over the years have created confusion, shame, or misinformation around this very normal part of human life. And for those entering or living through their 60s, 70s, or beyond, the question of how much is too much becomes especially relevant not only for personal satisfaction, but also for physical health, emotional well-being, relationships, and even broader aspects of aging like prostate health, hormone balance, energy levels, and sleep. Doctors and urologists who specialize in senior health are now speaking more openly than ever about the reality that masturbation in older adults is not just safe, but can be incredibly beneficial when practiced mindfully and in balance with one's lifestyle. But it's important to understand that the line between healthy and excessive isn't defined by a specific number or frequency. It's about the role it plays in your life, whether it's enhancing or interfering with your daily functioning, routines, or relationships, and how your body feels before, during, and after the act. For example, if a man in his 60s is masturbating once a day or a few times a week and feels energized, relaxed, and emotionally satisfied afterward, then this may be completely appropriate and healthy for him. But if someone finds themselves doing it so frequently that it interferes with sleep, causes chafing or pain, leads to a loss of interest in partnered intimacy, or becomes a compulsive coping mechanism for stress or boredom, doctors might view that as a red flag signaling that it's time to reevaluate habits, boundaries, or even underlying emotional or physical health conditions. Because excessive masturbation, like any behavior when used to escape uncomfortable emotions or fill a void, can shift from self-care to self-sabotage if not checked. On the flip side, older adults who feel shame for wanting to masturbate or who abstain due to social conditioning may miss out on the many proven benefits it offers, including the release of endorphins, improved blood circulation to the pelvic area, stress relief, better sleep quality, and even a natural boost in testosterone, which is crucial for older men who may already be dealing with the slow hormonal decline that occurs with aging. It also helps maintain erectile function by keeping the tissue in the penis active and oxygenated, prevents buildup in the prostate ducts, which could otherwise contribute to inflammation, and strengthens the pelvic floor muscles through orgasmic contractions, all of which support overall urological health, reduce the risk of erectile dysfunction, and enhance bladder control over time, meaning that moderate and regular masturbation can actually be part of a senior's health regimen, just like walking, stretching, or taking prescribed medications. Moreover, for individuals who are widowed, divorced, or simply not in a sexual relationship, masturbation can be a fulfilling and empowering way to stay connected to one's body, maintain sexual confidence, and even explore erotic desires or fantasies in a safe, private, and judgment-free space, contributing to a healthier outlook on aging, intimacy, and self-worth. The medical consensus among geriatric specialists, sex therapists, and urologists is clear. There is no one-size-fits-all when it comes to frequency, but rather, the focus should be on personal comfort, physical responses, and emotional balance. If the behavior isn't harming your body, consuming too much of your time, disrupting relationships, or being used to avoid deeper feelings that need attention, then it's likely just a normal and healthy part of aging. It's also important to address the many myths that older people may have internalized about masturbation, that it causes weakness, blindness, memory loss, or drains life energy, none of which are supported by science. And in fact, Such myths have often led to unnecessary guilt, especially among older generations who grew up during times when sexual expression was taboo. But today's research consistently shows that masturbation does not deplete health, but in fact supports it when practiced in balance and free from guilt. For those with arthritis or reduced dexterity, exploring different techniques or using lubricants or sex toys can make the experience more comfortable and enjoyable, while also reducing the risk of physical strain. And in cases where mobility or sensitivity changes have made pleasure more difficult, consulting a urologist or sex therapist who specializes in senior health can be incredibly helpful, offering new tools, approaches, and even medically supported options to enhance sensation or ease discomfort, so that masturbation remains a source of joy and not frustration. Understanding your body signals, such as whether masturbation leaves you feeling fulfilled or empty, energized or exhausted, connected or isolated, can also offer insights into whether your current habits are in alignment with your well-being or if adjustments are needed. Some older adults find that their libido fluctuates with stress levels, medications, hormone changes, or emotional shifts, and learning to adapt your approach based on your body's real-time feedback is a skill that leads to more satisfying and healthier sexual expression. Masturbation can also become an empowering act of reclaiming bodily autonomy as we age, especially in a society that often treats older adults as desexualized or invisible. But the truth is that sexual expression doesn't expire. It just evolves. And for many, solo pleasure becomes an even more meaningful and intentional experience in later life, one that doesn't rely on anyone else's schedule, mood, or performance, but is instead about tuning in, listening, and honoring your own needs, desires, and rhythms. In many cases, men and women over 60 may find themselves questioning their urges or wondering whether a sudden change in libido or frequency of masturbation is something to be concerned about. And this curiosity is completely valid because the aging process brings with it so many shifting elements. Hormones fluctuate, energy levels vary day to day, emotional states become more nuanced, and often people are dealing with complex life circumstances like retirement, loss of a partner, medical conditions, or changes in routine that can all impact their relationship with sexuality and the desire to engage in solo pleasure. So the key isn't to judge oneself based on what used to be or what someone else is doing, but rather to remain curious about what your body and emotions are signaling now and whether those needs are being met in a healthy, fulfilling way. Doctors note that occasional increases or decreases in sexual activity, including masturbation, are completely normal and often tied to changes in physical health, medication side effects, stress, and emotional well-being. And what's considered too much is less about numbers and more about context. Does the behavior interfere with your daily responsibilities, social life, sleep, or emotional connection with others? Or is it used to mask pain, avoid feelings, or substitute for deeper connection that might otherwise be available or needed? If the answer is yes, then this could be a sign to slow down and reflect, possibly with the guidance of a therapist or doctor who understands aging and sexual health. Because compulsive masturbation, like any behavior done excessively to escape emotion, can become a symptom of something deeper rather than a standalone issue. At the same time, it's important to reject the notion that older adults should have less interest in sex or solo pleasure. The truth is, many people in their 60s, 70s, and beyond report rich and satisfying sex lives, often even better than in their younger years, because they know their bodies, feel less pressure by performance, and are more attuned to what truly brings them joy, comfort, and connection, whether with a partner or alone. And masturbation plays an essential role in that intimacy and awareness. For men, regular masturbation helps keep erectile tissues healthy by promoting blood flow and oxygenation, preventing penile atrophy, and helping maintain sexual function over time, especially for those not engaging in regular partnered sex, while also serving as a natural outlet for stress reduction and emotional release, which can reduce the risk of anxiety and depression. Two very common challenges in older adults that often go unaddressed. For women, masturbation helps maintain vaginal elasticity, supports healthy lubrication, and promotes pelvic floor strength, reducing the risk of painful intercourse or incontinence later in life. And it also serves as a source of empowerment, particularly for those who grew up in generations where female pleasure was shamed or ignored. As aging progresses, masturbation can also help individuals better understand what types of touch, rhythm, or pressure feel best now. Because bodies change, and so do preferences, and taking the time to explore without judgment opens the door to better communication with a partner, if applicable, and greater ease with one's own body. Another important aspect to consider is the role of guilt, which many older adults still carry due to religious, cultural, or generational teachings that framed masturbation as dirty, sinful, or selfish, and these deeply internalized beliefs can cause emotional distress, even physical symptoms, which is why many health professionals stress the importance of education, self-compassion, and reframing masturbation as an act of self-care, much like exercise or meditation. When older individuals release this shame and embrace their sexuality as natural and valid, they often experience a profound sense of freedom, confidence, and vitality that spills over into other areas of life, boosting mood, motivation, and even their relationships with others. It's also vital to recognize that if masturbation becomes painful or difficult, that doesn't necessarily mean it should stop. It may simply mean adjustments are needed, like adding lubrication, experimenting with positions, using gentle aids or devices, or even speaking with a healthcare provider about hormonal shifts that might be affecting sensitivity, arousal, or climax. And for men, concerns like delayed ejaculation or softer erections can often be addressed through blood tests, lifestyle changes, or medications that support better circulation or hormone levels. While women might benefit from estrogen creams, pelvic floor therapy, or other treatments to support comfort and arousal. What matters most is not how often someone masturbates, but how that activity makes them feel, physically, emotionally, mentally, and whether it's contributing to or detracting from the overall quality of life. So tracking patterns, moods, and outcomes over time can be a helpful tool in assessing whether the current routine is healthy or in need of adjustment. For many seniors, finding a rhythm with masturbation that feels good and balanced, whether it's once a week, every day, or a few times per month, is less about frequency and more about the relationship they have with their bodies and the intentions behind their pleasure, and when approached with mindfulness, curiosity, and respect for one's own boundaries. Masturbation becomes not only a source of release, but a mirror reflecting how deeply one honors their changing body, needs, and desires. It can even become a meditative, grounding practice, especially for those who live alone or are navigating grief or change, serving as a reminder that pleasure, connection, and self-expression don't end with age, but rather take on new and more meaningful dimensions. Aging, in this context, becomes less about limitation and more about transformation, and masturbation, when free from shame and balanced with emotional awareness, becomes a quiet but powerful revolution of self-love and personal sovereignty in one's golden years. As the conversation continues around what's healthy and what's potentially harmful when it comes to masturbation in men and women over 60, many doctors emphasize the importance of context, because what's healthy for one individual might not feel right for another, and instead of focusing solely on how many times per week or month someone masturbates, The more meaningful question becomes how it fits into the broader picture of their mental, physical, and relational health, and whether it's enhancing or detracting from their ability to function, connect, and feel well overall. For instance, some older adults find that masturbation helps them sleep better, relieves tension, provides comfort in moments of loneliness, or maintains sexual function in the absence of a partner, all of which are valid and even encouraged by many health professionals, while others might find that they use it more frequently in times of boredom, anxiety, or emotional isolation, which doesn't necessarily mean it's a problem, but may suggest there are deeper needs, like companionship, stimulation, or purpose that aren't being met and are expressing themselves through repetitive solo sexual activity. And that's where the question of how much is too much becomes more philosophical and individual than clinical, because two people could have the exact same masturbation habits, and for one it may feel healing, healthy, and life-affirming, while for the other it may feel compulsive, guilt-ridden, and emotionally numbing. What's even more fascinating and often overlooked is how aging itself changes the body's response to masturbation over time. While younger people may experience quick, intense climaxes and short recovery times, older adults often find that arousal builds more slowly, sensitivity may shift, erections or lubrication take more time, and orgasms may feel less explosive but more full-bodied or emotionally rich. And when masturbation is practiced with patience, awareness, and a focus on sensation, rather than performance, it can become a deeply therapeutic experience that actually rewires the brain's relationship to pleasure, self-worth, and relaxation. Many older individuals find that they become more attuned to their own arousal cues as they age, learning to take their time, incorporate breath work, explore fantasies more consciously, or use erotic media in a way that feels expansive rather than addictive. And in doing so, masturbation becomes a form of self-exploration that allows for ongoing personal growth, healing from past shame or trauma, and an evolving relationship with sensuality that is not bound by youth or cultural expectations. For couples, individual masturbation can also be a healthy part of a shared intimate life. It doesn't have to be seen as a replacement or threat to partnered sex, but rather as a complementary practice that supports overall sexual well-being, especially if one partner has different levels of libido, physical limitations, or health concerns that impact frequency or type of sexual activity. When talked about openly, it can foster deeper trust, reduce resentment, and even lead to new forms of mutual pleasure or discovery. Yet, despite all these benefits, many older adults still feel hesitant to talk about masturbation with their doctors, which is why it's so essential that conversations like these become normalized and that healthcare providers create a safe, non-judgmental space where seniors feel comfortable bringing up their concerns, whether they're worried about overdoing it, feeling guilt, experiencing pain, or simply curious about what's normal for their age. Urologists and geriatric specialists often remind patients that if masturbation is leaving you feeling happy, relaxed, and physically well, and not interfering with your responsibilities, relationships, or emotional life, then it's not something to worry about, no matter how frequently you engage in it, because it's not about the act itself, but about your overall quality of life and the intention behind the behavior. On the other hand, if it starts to feel like an obligation, if you find yourself unable to stop even when you want to, or if you feel emotionally drained or physically sore afterward on a regular basis, that may be worth discussing with a trusted professional, not to judge or punish, but to understand what underlying needs or imbalances might be driving that compulsion, and whether there are more supportive ways to meet those needs. The truth is, masturbation is just one aspect of sexual health, and sexual health is just one part of total well-being, connected to diet, exercise, sleep, stress, community, and purpose. And when all these elements are working together, most people naturally find a rhythm with masturbation that feels nourishing rather than excessive. Aging doesn't mean giving up on sexuality. It means adjusting, learning, adapting, and listening more closely to the body's evolving messages. And masturbation can be a barometer of how well one is doing emotionally, physically, and spiritually, especially in later life when the distractions of youth have faded and self-awareness takes center stage. Some find that the frequency naturally decreases over time, not because desire is gone, but because pleasure becomes more intentional, less hurried, and more about connection with oneself, with memories, with imagination. And in this way, masturbation transforms from a simple release into a meaningful ritual, a gentle act of reclaiming joy, touch, and presence in a world that often forgets that older adults still long to feel, to explore, and to experience themselves as vibrant sexual beings. So rather than asking how much is too much, perhaps the more useful question is, how do you feel before, during, and after? Are you using this moment to nurture yourself or numb something? Are you feeling empowered or ashamed? Are you in alignment with your needs? Or are you avoiding something deeper that wants your attention? These questions help reframe the act of masturbation, not as something to tally or judge, but as something to understand, integrate, and ultimately celebrate. Because the freedom to know and enjoy your body at any age is one of the most fundamental and liberating human experiences. As we bring this deeply human and often unspoken topic to a close, it's important to acknowledge that for many older adults, especially those over 60, masturbation is more than just a physical act. It is a deeply layered personal experience tied to emotion, identity, health, and even the broader narrative of aging in a society that often misunderstands or ignores senior sexuality altogether. And that's why asking how much is too much is not about conforming to some arbitrary number or frequency, but rather about discovering what balance feels like in your own unique life story. Because what brings healing and joy to one person might feel hollow or distracting to another. And the key lies in cultivating awareness, honesty, and kindness toward yourself as you navigate this intimate relationship with your body and desires. Many older men and women grew up in eras where sex education was either completely absent or rooted in fear and shame, where pleasure was rarely discussed, and where self-touch was pathologized or condemned. And that legacy doesn't disappear just because the body ages. It stays quietly present in the background until we choose to unlearn it. And part of healthy aging is reclaiming that space. Understanding that there is nothing wrong, immature, or inappropriate about choosing to continue. Experiencing sexual pleasure, including masturbation, into your 60s, 70s, 80s, or beyond. In fact, current studies and expert opinions consistently affirm that masturbation is not only physically safe for the vast majority of older adults, but often beneficial, supporting mental clarity, improving mood through dopamine and oxytocin release, enhancing circulation to the genitals, preserving erectile and vaginal function, promoting better sleep, and helping relieve pain, anxiety, or stress. It's also one of the few types of sexual activity that allows for complete control, privacy, and safety, factors that become increasingly important for those managing chronic conditions, mobility issues, or emotional transitions like bereavement, divorce, or empty nest syndrome. And while there's still hesitation for many seniors in discussing these topics with healthcare providers or even partners, it's worth noting that the most progressive and compassionate doctors today are not only trained to support sexual wellness in older adults, but are actively encouraging these conversations because they know that sexual health is part of overall well-being. And ignoring it can have consequences just as real as overlooking diet, sleep, or exercise. So if you've been wondering whether your current masturbation habits are healthy or problematic, the best place to begin is by asking whether they're supporting your life goals, relationships, and peace of mind, or whether they're coming from a place of compulsion, avoidance, or dissatisfaction that might be better addressed with new tools, support, or attention to underlying needs. It might also help to reframe masturbation not as something that's done in secret or with guilt, but rather as a normal, nourishing, even joyful part of how you stay connected to your body, grounded in your emotions, and tuned into your needs. Because pleasure is not a privilege of the young, and desire is not something you're meant to outgrow. It's a current that evolves, deepens, and sometimes changes shape. But it remains part of you, as long as you are alive and willing to feel. For some, that might mean exploring new types of touch, using lubrication to support comfort, incorporating mindfulness or breath work into the experience, or simply allowing more time and space to enjoy the act without rushing or expectation. For others, it might mean exploring the emotional terrain of pleasure, understanding how past experiences have shaped your current attitudes, and deciding what beliefs you want to carry forward into this next chapter of life. And for many, it will mean acknowledging that yes, sometimes masturbation may become a habit that feels out of balance, but that doesn't make you broken, addicted, or shameful. It simply means your body is speaking, and there's an opportunity to listen with care, intention, and self-compassion. Healthy aging isn't about denying your body's signals or suppressing desire. It's about integrating them in a way that honors your current stage of life, meets your emotional needs, and keeps you feeling vibrant, grounded, and connected, both to yourself and to the world around you. And while society may not always reflect this truth in its portrayals of aging, every older adult who chooses to embrace their sexuality, to explore what brings them pleasure, and to remain curious about their changing body is actively rewriting the script and proving that vitality is only your way, as long as it brings you peace, balance, and a deeper sense of being at home in your own skin. You deserve that at any age, in any season of life, and your sexuality, no matter what shape it takes, remains a beautiful and valid part of who you are. So take this moment not just as an education, but as an invitation to live more freely, more fully, and more authentically, because the journey towards sexual self-understanding is never finished, and every step you take is a powerful act of self-respect, wisdom, and healthful living.